tell me what the motivation was? So you're looking at the camera. Why don't you tell me what the motivation was to join the Imagination Outcomes Challenge?
So I'd like to start off by thanking and congratulating Canada Health InfoWay for taking on the challenge and specifically including a challenge around medication reconciliation. Medication reconciliation, for those of us working in the hospital sector, is one of the most challenging and one of the most important functions we do. Medication management around patient safety and communication among providers is extremely important, and it is challenging. And this is an area that we and other organizations have been working on for some time. Having the InfoWay challenge has allowed us to align around a specific goal and actually measure some of the outcomes of the work that we've done to date. One of the great things about medication reconciliation is it engages the patient, engages our referring physicians, and it brings together the various interprofessional components of the healthcare team. In order for us to do this properly, we have to include pharmacists, nurses, physicians, and the patient in terms of reviewing their medications at the time of admission, and then reconciling them at the time of discharge, and then providing an appropriate and consumable format for the community physician or pharmacist to be able to know what medications the patient is on when they leave, and why, and what changes have been made over the course of their therapy.
So what has been the effect of being in the challenge? Did being in the challenge make any difference to the team, change behavior at all? What was the impact of actually being part of the challenge?
Being part of the challenge, first of all, validated the fact that although this is a very complex and difficult area, that it's an important one. And this also came out around the same time that InfoWay announced their priorities for the next 5 years strategically, and medication management was among them. So it sort of validated that we were on the right path in terms of pursuing this. It also created an environment where, you know, let's face it, as healthcare providers, we're always somewhat competitive. It allowed us to measure our results, you know, in a very friendly way with those of our peers in different organizations. And so once again, I think the challenge forced us to think about what we're doing, to validate some of our processes, to look at ways that we can improve, and I think to some degree see how we can measure our results and think about how we can continue to do better over time.
And what is innovation? So this is a challenge that rewards innovative teams for being innovative and working on technologies that are innovative. What does innovation mean to you, and why do you consider it important to continue to innovate?
Well, there are many definitions of innovation. I think I would just look at it very broadly and say innovating means doing things better. And in some cases, it may be taking a completely new tack. In other cases, it may be taking something that's been done well, but perhaps not broadly, and disseminating that across a wider spectrum. I think the real idea around the innovation is taking a good idea and bringing it into common practice, and to looking for opportunities to extend it into different areas. And in healthcare, it's all about deriving benefit and value out of the kind of work that we do.
And if you were going to, so you've been very successful in the challenge. You've won multiple awards. What effect does that have on you? And what will that mean for your organization and your team?
Well, I think the nice thing about having the recognition and the acknowledgement, quite frankly, is it allows us to create incentives for our staff, many of which are stretched in multiple directions. In many cases, we have, and I'm speaking about our project people and our developers and various people involved that have skills that are easily rewarded at a higher level outside of healthcare. And I think showing that they're contributing to improving care and being acknowledged and recognized really helps us give them a good sort of element of perspective as to how valuable their work is.
So just finally, is there anything that you want to let people know about being in the challenge? If someone was going to be joining the challenge in the future, what would you want them to know? What would you inform them about your experience?
So I think the challenge is an extremely rewarding sort of aspect of it. I think like many of these things, the most valuable part is participating and having the discipline to sort of align and state an objective and then collect data. I think when it comes specifically to some of the areas that we've looked at right now, I think we have to continue to raise the bar, and I think we should take these lessons and go a little bit more mainstream. I think I will feel much better when issues such as medication reconciliation aren't seen as innovative. They're seen as common medical practice and fairly routine. And I think the role of Canada Health Infoway here is to be able to help us take some of these initiatives at a national level.
Okay. So one last question, you have the floor. If there's something you want to tell anyone about being in the challenge or anything you want to say, let it out.
So I'd say get involved, get your teams involved, share ideas. I think perhaps a nice round of challenge maybe to look at multi-center relationships where not just one organization, but perhaps organizations from different provinces or different parts of the country work together as teams. I think that may even make it a little more interesting and reinforce our role as Canadians to commitment to a national healthcare system.